Hello everyone, welcome to my channel Ravi Study Physio. So in the series of medical physiotherapies, laws and ethics. So next topic is development of standardized protocol to avoid never miss and sentinel events. So what is that and how you can write in university examination? So let's discuss about that. So in healthcare system, patient safety is a critical priority. Error in the clinical practice may lead to never near miss event, not harm occur, but could have or sentinel event, serious adverse event causing the harm or death. So any kind of treatment procedure occur into the patient by the therapist or doctor. So any kind of harm, potential hazardous, or any kind of sentinel event, serious adverse effect occur into the patient. So that is come occur into the sentinel events and standard protocol avoid never misconduct. These events are often preventable and reflecting gaps in healthcare delivery system. So in healthcare system, these condition of the never miss or sentinel events are very common types of errors. So the healthcare department regularly is working on that did not occur in the future. In physiotherapy practices, where the manual handling in electrotherapy or exercise prescriptions are commonly improved technique and misjudgment can result the serious consequence. So during the electrotherapy and physical therapy or during the manipulation therapy, you have to be keep this thing in mind, the patient assessment and the patient acknowledgement about the treatment procedure and potential hazards. There is alternative options and there is a contraindication, so have to be prevent over the never miss or sentinel events during the treatment procedure. So introduction about that. So, an incident that could have a cause harm but did not either by chance or timely intervention. Example, wrong patient modality setup but identified before application. So any kind of setup has to be in your clinic and setups of your hospital, and you have to be implement on the patient before knowing any potential hazard and the contraindication. So it is then it can be before the knowing the contraindication. So you have to be treat that, and after that burning you have to be aware about that there can be cause severe burnings and over the patient localized or general skin. So you have to be like to be remove over the placement or to remove the gadgets or on the patient. So it will be incidents before the application. So that is the never miss or sentinel event to provide over the patient. What is the sentinel events? A series of unexpected occurrence involving like death, permanent harm, and severe or temporary harms. So example, electrical burn during electrotherapy due to the faulty equipment. So any kind of faulty or long-term use of electrotherapy gadget cause the electrical burn over the patient comes under the sentinel event, and you have to be take the compensation or money to not claim against you as a medical legal cases into the court. So components of standardized protocol. So risk identification. To prevention of the sentinel event or never misconducts, first is a risk identification. Identify high risk procedure, example spinal manipulation, or electrotherapy gadgets. The patient related risk like age and comorbidities. So patient is comfortable of particular electronic device or not, or particular manipulation therapy or not, or you have to be spinal manipulation or not. So they depend upon the age, gender, and comorbidities. So make sure this risk is identified before the treatment procedure. Second one is standard operating procedure, the step-by-step guidelines for the treatment and clear instruction for the equipment. So in the senior doctor have to be keep regular guidance and have to be have to be set the protocol to the treatment procedure over the patient, different age and different gender of the junior staffs and junior physiotherapists by the particular electronic gadget and manipulation therapies. Next is to be clinical checklist, pre-treatment verification, patient identify, diagnose, and equipment safety checking. So before implement the patient over the any kind of electronic gadget or device or any gadget, so you have to be first check the sensory level of the patient and also the gadget device is properly working or not. Next is to be documentation system, accurate recording of the assessment findings, treatment plan, and consent. These three things have to be make sure before the treatment procedure. You have to be set the document procedure over the patient. Next is to be training competence, regular staff training, skill validation for the therapist. You have to be keep advisory over the patient, over the junior staffs for implement their new skills, regular training to not give to any never misconduct or sentinel events will be occur into their clinics. Next is to be communication protocol, interdisciplinary communication and patient education. Interdisciplinary communication is to be one doctor to other doctor to the junior doctor. This is the interdisciplinary communication, which will not have to be any larger gap, and also the patient education towards the any therapeutic approaches or also the electronic devices. Next is to be incident reporting system, non-punishable reporting, curate culture, anonymous reporting option. So any kind of harmful effect has to be there, so you have to be keep this thing in mind. This machine is not performed well, so you have to be eliminate or discard this medicine and implement new medicine, new machine. Next will be audit and quality improvement, checking the audit assessment, regular audit feedback and corrective action towards the any gadget, any manipulation therapist towards the patient for the betterment of enhancement of the healthcare department. Types of the Sentinel event. So there are such types. First is treatment related event. First is wrong modalities application, incorrect doses, and ultrasound intensity. So it will be cause the Sentinel event, and you have to be case on by the patient claim on the court of the medical legal case. Procedure related event: injury during mobilization, manipulation, falls during gait training. During the treatment procedure, any kind of manipulation doing towards the patient, so any harmful effect and any kind of clicking or like knock sound are coming, and patient complains you have to be pain arise by your this sound, so there is have to be false towards you and claim against action on you. So during do not take serious gait training into acute and hemorrhagic condition of the patient. Next is to be equipment related events, so electrical burn and malfunctioning machine. So you have to be keep thing in your mind, machine is proper working and do not have to be electrical burn onto the patient. Next is to be medication related events, so into the ICU the so incorrect drug advice by the physiotherapists have to become into the medical legal cases. Patient protection event, patient falls, improve transfer technique. Patient have to be fall into the plinth into the floor during the transfer technique or into the cupping vibration technique into the physiotherapy treatment in the cardiopulmonary rehabilitation. So it will be claim against action into the court. Documentation and communication errors, so misinterpretation or medical diagnosis lack the information consent. You have to be any kind of have to be incorrect diagnosis and incorrect treatment procedure can lacking the communication of the patient or the doctor, it cause claim wrong diagnosis and wrong treatment procedure and not healing properly. It will be comes under the Sentinel event. Preventive strategies of this: the first is standardization of the procedure, use evidence-based treatment protocols and avoid improvisation without clinical reasoning. So you have to be keep these things in mind. You have to be keep learning every day on the patient and new equipment and new manipulation techniques and the gadgets. You have to research on the patient, it will be improving or not. So that is the standardized procedure. Second is improper present assessment, detailed history and physical examination, identify contraindication. These three things help to patient and therapist interrelationship and boost up the psychological treatment, and also the detailed history can treat this treat the socio-economic treatment and psychological relaxation. Next is to be informed consent. Before starting any treatment procedure, you have to be keep signed by written form, the consent form, the explain risk, benefits, clearly obtain written consent, and any alternative option you have to be keep mentioning to the patient and have to be share such information by verbally. Next is to be equipment safety, regular maintenance and calibration of the particular gadgets and make use disinfection. So keep equipment safety and standardized towards the any kind of bacterial and viral infection on the machine. Staff education, continuous professional development, emergency management and training towards the patient, any kind of gadgets, any manipulation techniques into the during the treatment procedure. Use of checklist, WHO safety checklist, model adaptation, pre-therapy verification. So you have implementing any kind of gadgets, any kind of manipulation techniques. So first, World Health Organization has to be safety checklist over the written form. So you have to check over there this technique is useful or not. If not, so you have not used by your clinic, so it will be very harmful. Effective communication, clear instruction to the patient and team coordination. If patient education is there, so it will be relationship of the patient and therapist should be good, and also the team coordination is to be there. So boost up the improve the patient and mentality if it is surrounding environment is a good, as it will be also treat the psychological healing into the particular healthcare department. Safe environment, non-slip floors, proper lighting, and adequate space. If one patient to other patient bed is to be proper distance, do not beneath over there, and to the one bed is to be closed nearby the other patient. And separate male and female ward, non-sleep floor, because patient have to be not proper gate pattern, so it will be sleep over there, and proper lighting to keep start performing the procedure very accurately. Steps in managing sentinel events. So first step is immediate patient care, stabilize patient, provide emergency intervention, any kind of acute injury, so you have to provide first aid towards the patient. It is the first immediate patient care. Second step is to be report the incident, inform senior authority, and document for the event. So you have to be not handling by yourself, to call the senior authority, so prevent the risk. It is the second step. Third step is to be ensure safety, remove faulty equipment, stop unsafe procedure. You have to never know about that treatment procedure and the manipulation therapy or electronic gadget, how to be initiate and start on implement on the patient. So you have never ever used this such kind of equipment on the patient. Step 4 is to be documentation, time, place, and nature of the event, staff involvement, and patient condition. You have to be written on the documentation of the patient. So you have to be show the senior authority what kind of scenario which will be occur into the patient. So that is the end of the development of standardization protocol of avoid near miss or sentinel events. You have write in university examination and achieve a good marks. Thank you.